In a suburb just outside Atlanta, Georgia, Jen and Roger Sittler start their day feeding their daughter, 13-month-old Leela. She's a dream come true for the two young professionals. But the early days after she was born were difficult.
She wasn't getting any food in, she wasn't eating, she wasn't sleeping. I mean, we were very, very worried and concerned.
I certainly didn't think it was normal. I'd never heard of, a baby crying for 6 or 7 hours at a time without stopping.
Thank you. She was supposed to be eating, so many ounces a day, and she was having 1/10 of what the daily requirements were.
While it is not uncommon for babies to cry, Leela was diagnosed with gastroesophageal reflux disease, or GERD. Reflux disease in infants, babies, and children can manifest itself through stomach pain, but may also include asthma, breathing difficulties, persistent cough, and/or a refusal to eat.
So if they have a lot of discomfort as they regurgitate and spit up and have reflux, then they may just quit eating. That's a serious problem and can lead to what we call a true failure to thrive.
She was the 90th percentile for height and the 10th percentile in weight. So obviously that's a huge gap there. She got sick right after that.
As difficult as it may be for parents to watch their babies and young children struggle with reflux disease, or GERD, in most cases, experts say this won't be a long-lasting problem.
There are a variety of non-medical ways to try to deal with reflux, and we usually encourage parents to really try to help their child, make some lifestyle changes.
Lifestyle measures for infants include elevating the head of the baby's crib or bassinet, holding the baby upright for 30 minutes after a feeding, thickening bottle feedings with cereal, changing feeding schedules, and trying solid foods with the doctor's approval.
Where's Owl? You show Mommy where Owl is?
Jen and Roger Sittler remember the coping recommendations they received to try and help Leela.
We did everything all at the same time. We had her in a bassinet next to us, and we had that elevated. Mm-hmm. We did the rice cereal in the milk.
We did anything.
Anything and any suggestion that someone gave us, we would try it.
Right.
And it didn't work. Yeah, it didn't work.
Once you employ the conservative measures, and there's a number of patients with mild GERD that respond to those. There are some that it persists, and then you go to the second major group, which are pharmacologic or medication therapy.
Jen and Roger tried Leela on a proton pump inhibitor that blocks the formation of acid in her stomach.
Complete 180.
Yeah, a huge turnaround is an understatement. Yeah, 180, yeah. It's amazing. It really is. It's been great. At this stage, I think that we've come to the conclusion that this is what's best for her, and if she has to be on it forever, then we'll deal with that when it comes, but we are going to try and wean her off.
Doctors say that if medication is needed, there are safe and effective treatments to help relieve symptoms and get reflux under control.